As I began to practice, for the last 13 years in private practice, having kids come through, there were consistent patterns that I saw over and over and over again. All those things started showing patterns in how a child was growing, their dental crowding, how they're breathing, how their entire growth and development was changing because of their breathing patterns. And what we found is, as we instituted our breathe method consistently in these families and in these children, we saw consistent, repeatable outcomes. And we were seeing the excitement that families had and parents had as we were improving their children's lives and their ability to have a healthier life, healthier sleep. And now we're seeing those not just with the pediatric patient, but the teenage patient and the adult patient. What I found in my own practice was that for years I was treating teeth. I was overlooking many of the symptoms and actually dismissing a lot of symptoms. Parents would come to me for years saying my child grinds at night, and I said what every other dentist said, is they'll grow out of it. But I realized that I was overlooking the airway. And as I began to understand what the symptoms were and how much parents really wanted answers to these solutions, as we began to develop the breathe method, we realized how much of a win-win situation it was, not just for our practice, but for the child and for the parents. And it became an exciting opportunity as we started implementing that in our own practice to see the changes in our patients. The breathe method is a structured, repeatable, airway-focused treatment modality. It's not just expanders. It's proper diagnosis. It's proper treatment planning. It's proper implementation, proper follow-up and integration into your practice. The breathe method doesn't just encompass just the clinical component. It's actually how to implement this in your own practice and have it be successful. Here's what you'll learn: how the breathe method is right for each patient, how to implement, which cases to select, which cases to not select, what are the red flags, what are the things that you should be looking for, how to diagnose properly, and how to properly implement with each specific case selection. During the seminar, we're going to give you a full understanding of everything you would need to be able to implement the breathe method in your practice. What types of expanders, how do we use them, how do we best implement them, what specific modifications do we need to make, what things you may need to bring into your own practice, whether it be scanners, CBCTs, how to utilize each of those specific technologies in your own practice to be successful with the breathe method. So understanding the breathe method is understanding, once we've implemented, how do we follow up? How do we ensure that each patient goes through the entire process, start to finish, and gets the most predictable outcome each time? And that takes each team member understanding their role. We're going to give you an understanding of how to implement each of those specific things when it comes to every different team member in your office so that you can be successful. Coming to our seminar is not just about implementing things clinically. It's how to actually implement the breathe method successfully in your practice so that it can be something that helps grow your practice, to how to monitor, track KPIs, how to ensure that we are actually converting patients, and how do we bring more patients into the office to become more successful with the breathe method. I've gone to many seminars where I've learned a clinical skill, but then I've gone back and I haven't known how to actually implement that into my practice. Part of our seminar is I want you to not just learn how to implement it clinically. I want you to be able to go back to your team to have a cookie cutter plan that you can take for your front desk on how they're to answer the phones, the assistant, how they're supposed to check in, bring back, set up, to what is the instruments that you need. What does the consultation look like? What does the follow-up look like? What follow-up emails we're going to send, so that everything is ready for you from day one to implement the breathe method into your own practice. Once you've come to the course and you've gone back and you've begun to implement the breathe method in your own office, you're going to see what I've seen. You're going to have families coming back who are going to, like a patient who was in my practice who used to wake up every night and he would sleepwalk, and he would open and unlock the front door and he would walk out into the middle of the road. And during that consultation, I sat with that mother as she cried and said, "Dr. Warcup, I never sleep. I'm concerned that my son is going to walk out in the middle of the road every single night." And we were about 3 months into treatment. She walked in my office with tears down her cheek and said, "Dr. Warcup, we haven't sleptwalked for an entire month." That is an amazing day to practice. And those experiences you will find will be more consistent. Or the police officer that came in, he looks like The Rock. He's about 6'5", about 280 pounds. And a really tough guy comes in and he says, "Dr. Warcup, this is a whole nother child. Thank you." And those are wonderful, wonderful experiences. And you're gonna find that you're gonna have those with your own patients. As you implement the Breathe method in your own office, what you're gonna find is kids are going to come back and you're going to hear parents say that their child's sleeping better, that they're focusing better in school, that a child who was diagnosed with ADHD is no longer on medication. A child who has been told at school he's the class clown or he's flunking out of school is now going to be the straight A student. You're going to hear these wonderful stories over and over again. And now you're going to actually find people are going to be talking about you because you're changing their life. Yes, we can change children's lives by doing fillings, but you're going to change not just their current life, but the overall growth and trajectory of their entire future. If you're ready to elevate your practice, if you believe airway matters, if you want to lead instead of follow, come join me.